passes through, pop there, so we're going to go into the deep cheek fat. And there you can feel it passing through the lobular fat. So we're injecting Radiesse into a late 20s male, and he's interested in maintaining the shape of his cheek. And right now the technique that I'm using is a cannula technique, and basically this technique was described in the Journal of Cosmetic and Aesthetic Surgery called the dual plane technique. And we're actually filling in the deep cheek fat now using a micro cannula. This is a blunt tip method of injecting a filler after you create a port with a needle that's the equivalent size of the micro cannula you're working with. Overall, it does have a reduced risk of having an intravascular event, which can occur with fillers, and overall it's a little more comfortable for the patient. On a scale of 1 to 10, how does this feel to you right now? 10 is painful.
Yeah, I'd say like 1 or 2.
Okay, and you see the patient's not miserable and uncomfortable to the point where they're not able to communicate. And you've had needles in the past. How does this feel to you compared to a needle technique?
Much better, more comfortable.
Really great. Not every injector is using the cannula technique, but I find it to be allow for a lot more precise placement of the product in the tissue plane that I want it to go in, with minimal concern of any intravascular event, and overall less bruising for the patient, which means they can have their procedure done and go right back to their life. Pressure here. I'm just going to go into your cheek and put a little bit here. Yeah, that's looking good. Same thing here. The pressure as the cannula passes through, you can actually feel the cannula as the injector passing through the individual fibrous septa and the fat lobules of the face, and you can actually see it rise up in areas. You can actually palpate the implant in the subcutaneous space as well. And I'm going to continue to soften that transition from his cheek to his soft cheek by layering in filler just beneath that area. You can actually see the tissue rise up, and again, you're using a cannula, so there's going to be a little more resistance as the injector as you place the product through the microcannula. And so I'm going to stop and assess this face now and see where we are. And how does that feel to you now?
Perfect.
Pretty good. So we did about 0.6 altogether in his deep cheek, and transitioning down to his soft cheek. We kept his prominence in the medial position. We didn't move it too far laterally, which would feminize the milk face. I'm going to come around. And then when you're using the microcannula, I will say, it's a lot like doing liposuction. It's going to take a little bit of pressure to pass through the fibrous septa, and there will be a point where it does pop. You always just get in communication with the patient. If you have any excessive discomfort, please let me know. Into that area.
Yeah, fine.
Okay, good. But there's a point where it pops, and it just popped through the lateral septa. And again, this is a blunt tip cannula, so I don't have to be concerned. I certainly have to continue to think about it, but I don't have to be as concerned about intravascular injection. I am periosteal along the deep medial cheek fat and the deep buccal fat in this area. And we'll begin our injection now. And we placed about 0.3 to 0.4. And certainly this is specific for this patient. I would not do that for every patient. There's no formula to injecting the amount of filler. Every case is different. And I am not doing retrograde injection or anterograde injection. I'm actually placing my cannula and putting the aliquots in the pockets of fat, or the deep fat pockets that I want the product to be in. So, and some fillers you actually inject as you pull out. I'm actually placing the cannula where I want it, feeling the cheek rise, and then stopping as I move the cannula to the new location. And again, the goal is to actually maintain the use of one single port to do the correction, and you can actually feel as that cannula comes out of one compartment and frees itself up to go into another compartment. Right now we're kind of in the lateral soothe area, which is going to give him a little bit of prominence on his cheek, which he asked for, so we're going to give that to him. Now we're going to take the last bit of product and go in and just kind of feather it down, blending it along the soft cheek, and I'm actually palpating to feel my cannula underneath the surface so I'm not deep in any muscles in this area in the parotid duct. And my goal with any injection is to have a nice, soft, natural correction. I do not like for my patients to look done. So when he's finished, we'll show you his before and afters that we'll take with the camera platform at the end, but I do want them to be comfortable and to look natural with their appearance. I think the key to aging gracefully is to have it occur gradually over time. Very good. Now we'll do the nasolabial fold to complete his correction. Smile for me and relax. One of the key things you'll notice about doing this procedure, I don't have an assistant who's having to hold pressure, and this technique specifically being the microcannula technique is I don't have to have an assistant at the bedside holding pressure or any concern for excessive bleeding, because again I'm using a single port of entry to correct multiple different tissue planes and multiple different tissue pockets at once. And Sam, how do you feel now? Is that okay?
Mm-hmm.
Okay, good. And again, my goal being to lift the nasolabial fold, I'm feeling posterior to it, not going directly in the fold to the very end. Small amounts of product, and occasionally you'll see a little bit of product causing elevation in the tissue. That will massage down really nicely, specifically with this product we're working with today, which is Radiesse. A little pressure as I pass up into the nasolabial fold area. Again, I feel that my cannula is in the deep subcutaneous space. I've done some correction posteriorly to the fold, so I'll do a little bit of final correction just in the fold and put the remaining product posterior to the fold to continue the elevation.
Surprised how comfortable it is.
That's really amazing. I love this technique. I can honestly say after having used a microcannula, I'll never use any other technique again, except in fine detail areas. Cupid's bow, I tend to use needles still. That's an area that you can't really access with the cannula, specifically when you're working on the central angle. I find that I still have to use a needle. So all of the filler is in, so now I'm just going to check it for even placement, and I'm looking for changes in contour angles from a variety of different positions. Notice that I'm not looking from the straightforward position. I can actually see the angles much better from the upper and the lower lateral sides. And again, I'm palpating the product. I'm not really concerned or applying pressure for bleeding in this case. It is normal for patients following filler to occasionally feel an implant underneath their skin that always molds in over the course of about 2 weeks. So everything is fine there. Now we're going to change gears and do a little bit of Botox. He's been doing Botox for quite a while, and he's going to furrow for us, look angry, and I'm going to do just a quick little injection in this area to soften this muscle, and then we're going to do a little bit out here. And then last but not least, working symmetrically out here. And then I know that I'm going to go in the center, so I'm going to drop 2 right here. Good. Raise your brow and look surprised for me. Good, then relax. And he's got a little bit likely some overlap of frontalis. We're going to do 2 units there. Raise your brow again. And I like to, for patients who can tolerate, actually get a little bit of elevation in lateral brow, He's a male who it actually will work on. There are some men who this wouldn't work for, but the shape of his brow will allow for it. So we're going to do a little bit of a brow lifting out of the lateral aspect of frontalis, allowing the medial portion to relax and the lateral frontalis to elevate the brow. And the really great thing is I know that I'm going to see this patient pretty regularly, so we can titrate his look. 2 minutes there. Good. And now we're going to work around the eyes. Good.
Anything I have to do with the Radiesse for tonight?
There's nothing that you have to do. With some fillers you do have to massage. This filler you don't have to do anything at all. There you go. So let's take a look at everything now. Raise your brow and look surprised. It's going to be angry. Okay, and then relax. I'm going to do just a little bit in the lateral corrugator too, because that's still pretty strong. And then squint again and look angry and then relax. Okay, good. Very good. Now, Botox, of course, is going to take a couple of weeks to take full effect. For some of the veterans, it can only take just a couple of days. Everybody is different. There's no magic formula. It's normal for patients to have a little bit of redness after the injection or anytime a needle passes through the skin. It's just a basic histamine reaction. They can take an antihistamine when they go home or prep with antihistamines to reduce that effect if they don't have cover-up. In this case, he's going to go home, so I don't have to worry about that. I'm pretty pleased with everything. That's everything. Have a heart-shaped face, so I didn't want to kind of remove that and make you square, so I stayed away from the lateral cheek even more. So
Perfect. I love it.
Good.